we're gonna do a little bit of mesh on his cheek into this area. So I'm going to, I'm gonna create a little bit of, the thing what you have to understand with mesh is you still need to create a little bit of a port. So we're gonna create a port site on here and create a port site right here. All right, and so this is gonna help to revolumize his cheek. Okay, so this is the goal, is to revolumize his cheek. We're gonna kind of take it, you wanna always pinch tissue. And then when we pinch tissue, then we wanna follow it through. Follow it through, okay? And so we kind of twist it one way, I twist it the other way just to make sure. You kind of feel certain things get caught and then twist the other way. And that kind of releases your thread and allows you to place it into the right place. And so we placed it right kind of where his acne scars are, so that mesh will start to build collagen in that area as well. We're gonna move on and put one more mesh into this area. So I'm going to use my left hand so you guys can see. Kind of, it is a good push into there. Okay, it's not a soft one. Sometimes I twist, and there we go. And we placed it in there. Kind of hold it, I twist one way, I twist the other way, and you'll feel it kind of release itself. Perfect. And so we've actually created 2 meshes on his cheek to create a little volumization. And then we're gonna use some smooth. So we're actually gonna use some smooth twists. So difference between smooth and smooth twist is that the twist is actually a longer version of the smooth. It's just that the thread itself is wrapped around the area or around the needle more. So essentially you're getting more PDO, and this is gonna be more PDO threads that is wrapped around the thread itself, so you're gonna get more collagen stimulation. So both are great, it just comes down to what you want to do more so. And so remember, screw does mean twist, thread, screw, interchangeable, kind of like barbs and cogs, they're interchangeable. The industry is very confusing, so when you hear twist or you hear screws, they do mean the same thing. They do have one they call twin twist, which is actually where the 2 threads are entwined or braided together, and then they're twisted over the actual needle itself. That's going to create more collagen stimulation. But of course, as you do these things, you have to remember that the more twisting, the more threads, the more potential expensive it gets. So you have to look at your expenses and what you want to spend on a patient, how much you're going to charge them. But we're going to use the twist on him to get some collagen stimulation. So I don't know if you can see this, but this does have the little twisting. So you can see it's wrapped around it, kind of like you're wrapping candy cane type of a thing. And so this twists around the thread. And so we're gonna come in from this bottom portion, and I'm just gonna place it up through this area. And you're gonna place it into the deeper dermis. If you come up superficially and your thread comes out the other side, it's a wasted thread. Just unfortunately pull the thread out. You're done with it. So just make sure that you are staying deep into the tissue. These are just experiential things where you get fast with it and then you start sticking, and then you eventually stick the needle up on the other side and you're like, crap, what happened? It's essentially you didn't stay in the right plane and you didn't stay in the deeper dermis area, and so you ended up with a little bit more superficial thread, and if it comes out on the other side, it's essentially a potential for infection. So just make sure that you do pull it out. If a patient comes and complains, there can be some migrational aspect of these threads. It's not that it just because you place it there, they can't move around. I have had patients where we've placed in the proper area and then over the next week or 2 weeks, it does shift a tiny little bit and they're like, I can feel the thread, and then they eventually are actually able to pull it out. So make sure you are trying to place it in the right area. If you do get a little bleeding, do put pressure on the area. The more pressure, the less bruising a patient will have. So don't be in a rush to do all of this. It is important that you do try to stop the bleeding when you can. So this is one where you can just put in your threads all at one time. I like to pinch the tissue. Oops, so see, I came out. That's me, my bad. That came up. You can see there's a thread right here. Once I pull this out, there's a thread right here. Not good. Pull it out. Okay, wasted thread. So make sure that you are good about your placement. That's a good one to show you guys what not to do, because then you end up wasting a thread. So this is the reason why sometimes I do pinch along the tissue line and I make sure that I stay in that deeper dermis area so that you don't get that tip that comes out. So we're just trying to stimulate his skin to produce more collagen. It'll help with the acne scars that he's concerned with. For patients who have a lot of wrinkling or a lot of tissue sun damage, who have this looser skin in that aspect, you can consider using smooth and twist threads to actually revolumize their face, thicken up the skin so that you can help them with their tissue quality. So don't think that you actually have to continue doing collagen stimulation through just lasers or microneedling. All of those in combination are beautiful if you can do that, of course. But if you're just stuck with one thing, threads in and of themselves can actually do all of that stuff too. Threads, even if placed in the right place, in the right layer, can actually kill fat. So do some research. If you place in the subcutaneous fat layer, you will get some fat destruction as well. So I'm just placing all 10 of them because once I open a packet, I want to just use it all. I feel as though there's a little bit more that I want to put right here. One last one. Place it this way, actually. All right. We're done with this side. How was that? Not too bad? Good. So sometimes after I finish placing all of these threads, it is a little bit more traumatizing to the tissue. So hold some pressure in there for a minute or so, or have the patient hold some ice on the area. That will actually minimize a little bit of the bruising, minimize some inflammation going on. And remember, these collagen stimulators, the mesh, the twist, the smooths, all of those are going to take time to stimulate collagen. It's not something that's going to happen right away. They may get some mild inflammation that makes the area look better, but it does not mean that they're going to actually have full collagen stimulation in the area just yet. It takes a couple of weeks to stimulate collagen, and it may take more than one treatment to actually do the right amount of collagen stimulation. So now we're going to start off with doing one on this mid cheek to give him a little bit of volume in here. Pinch. One. And we're going to pinch tissue. And we want to get into the subcutaneous, so you gotta make sure that you're in the right proper plane. As you can see, we're gonna push through a little bit more through. So we're gonna give him some volume into this area. Beautiful. So you kind of see how we've created some volume. I like this, so what I'm going to do is I'm going to actually use the same entry point and give him a little bit more. Oh. I'm going to create a little bit this way. Further down. You can see where we are there. I twist one way, I twist the other way, and it feels like it starts to release. Pretty. You did a nice job. Okay. Now for his acne scars in this area, we're going to use a little twisting. So we're going to place this leave those in place. And you can leave your smooths in place. Sometimes I do. Kind of creates a little tension. You kind of see where you can go from there. After I do put them in, I do give it a little twist. Pinch. These pinch a little. Most patients, I will just do topical numbing if you're doing superficial threads. It's the deeper barbed threads that you'll do the lidocaines for. You kind of see how that's turning out beautifully. Pinch. Twisting as we're coming out. There's a little bit more acne scars in this one area, so I'm going to go ahead and put a little bit more in that area into a different way. I think his skin bends this way easily, so I'm going to go this way. And you can feel it. When you squeeze on it this way, you can actually feel the threads and how it's volumized the area and give him structure into that area. So I like what I'm feeling. Sometimes it feels, I may have hit a little blood vessel, so I feel a little bit mild swelling. So just hold some pressure on the area. That will do a nice job softening up the area. And while I'm doing that, let's take a few and actually take a little and go a little into his nasojugal fold. Follow this nasojugal fold off. Beautiful. So there'll be a little bit of swelling, mild swelling. We put a twist into this area. We put another one onto this area. This side of his face didn't have as much acne scarring as the other side, so we don't need to put as many, but I'm gonna put a little pinch. And we're gonna, sorry. Follow it out. Perfect. Alrighty, that's done. Beautiful. Hopefully you guys learned a lot. Keep playing with your threads. There's so many different ways and techniques to do this. I don't think we can cover it all, but just learn your depths, learn where each thread is going to be giving you your maximal effect, and let us know if you have any questions.